Bob. Bob's our Chief Commercial Officer. He's been really great at helping take our company from good to great. And when Bob came on, he said, you have an identity crisis. Nobody knows about what you do. And so we're going to explain today the history behind this, how we've successfully placed this in over 300 clinics across the country, including Mayo Clinic, Cleveland Clinic, Baylor University, University of California, San Francisco, San Diego, as well as a dual research with Harvard and MIT. And the technology itself has been around for 40 years. It's genuine lithotripsy, the same technology they used to break up kidney stones for the last 40 years. This is it. It's using electro-hydraulically produced sound waves that are traveling at 3,355 miles an hour. So that's 4.4 times the speed of sound, or 4.4 Mach. And you know, for 4 decades, lithotripsy has been described as a non-significant risk factor because it has minimal side effects, there's little downtime, and people are in and out within literally minutes of procedure. This is lower intensity, it's unfocused, so it's not as strong as the ones they use in hospital to break up kidney stones, biliary stones, and salivary stones. You don't have to be knocked out with anesthetics with this. We actually like this because there's a biofeedback component, meaning when I run this over normal area, no pain. As soon as I get to a bad area that has poor circulation, inflammation, arthritis, or a torn ligament, there's this biofeedback component where you're like right there, okay? So this can really detect where the true source of pain is coming from. It's used in several professional sporting teams, including the Chicago Cubs and Cleveland Indians. LA Lakers have one, Memphis Grizzlies, New York Knicks, New York Nets. Martin O'Malley, who is a foot and ankle specialist with the NBA, has 2 devices here in New York City. He treats thousands of NBA players, and he actually, when Kevin Durant tore his ACL, Kevin flew all the way from the Bay Area to New York City. Dr. O'Malley repaired his Achilles and then used this right in the surgery. This has an antimicrobial and antibacterial effect as well. So we have been cleared as a Class 2 device to work with wounds, ulcers, and connective tissue, activation of connective tissue. What is connective tissue? It is the building matrix of all tissue. So, I mean, if it's cartilage or tendons or ligaments, so our company is called Softwave Tissue Regeneration Technologies. So the other cool thing about this is you basically, wherever we place this on the human body, we get a positive biological effect. We help decrease pain, decrease inflammation, improve circulation, improve range of motion. And that's really why patients are finding this all across the country, is the amazing results we're getting. And the proof is in the pudding, as we like to say. Dr. Jim Krybek has the first device within the orthology group, and we're really excited about what they're just doing only in internal marketing. So you can use your patient database just to market and really get this going. The other cool thing about this is this has been used for the last 12 years in the Austrian workers' comp system. And if you know anything about Austria, it may be the greatest healthcare system in the world. Because if you're injured there, you can go anywhere in the world to get treatment if it's not offered in Austria. And for years, workers were going down into Germany to have this done for different ailments, lumbar, low back issues, non-healing fractures. And originally, they got a demo for 3 months from our company to put it in the Austrian, one of their trauma centers. And the director at the time went to Wolfgang Schaden and said, hey, we're spending so much money paying for people to go to Germany to have this treatment. I want you to prove to me that this is a sham. Can you imagine? So Dr. Schaden gets this thing he had it for 3 months, and after 45 days, he goes to his director and says, I can't live without this. This thing really works well on the musculoskeletal issues, the low back cases. I mean, let's face it, an average lumbar diagnosis for a health insurance company costs $18,000. We just submitted a case study where we were able to, in 6 visits, 3 weeks, $650 take care of a woman who had a tear in her hamstring, very connected to the ischial tube, and a tear in her medial glute. 6 weeks. She couldn't walk upstairs. She couldn't walk up hills. So obviously, you know, insurance companies are starting to notice this. There's a code 0101T, and as of January, Medicare will be on Medicare's reimbursement schedule. And really that's it. I mean, the other really cool thing is that we have this for wounds. So we have a Dermagold. We have it for urologists are using this. So there's an Uragold. We have it for, there's a cardiac division. So there's a cardiac CRT. And then the one that we're demoing today is called the Orthogold 100. So there's over 130 peer-reviewed studies now on this technology. And I think the coolest thing is in the regenerative medicine world. I believe that this will be considered true cellular regenerative medicine as people start to absorb and digest this research. Because what's happening is within 45 minutes of a treatment, you're actually activating your body's own natural stem cells to come out of this dormant state and almost flock to this area where we're treating. You should get excited about this. I mean, do you hear that? I mean, if your patients, and you've had them, go out for stem cells, what does it cost for a stem cell injection? Thousands. One injection. Average patient that goes in for stem cells is $7,500. Now, I say stem cells may be the future of healthcare, but right now they're the future for millionaires and professional athletes, because those are the only ones that can risk spending $7,000 to $10,000, and really it's a roll of the dice to see what happens. It's a 50-50 outcome. This, we're seeing 65 to 91% success rate with musculoskeletal disorders. And I have this little saying in our clinic, we're like the Statue of Liberty. You know, send us your failures. Send us your poor and tired patients that aren't doing well with conservative care. And that's literally, when we come in for a training day, we literally have you line up 12 to 15 of your worst cases. The ones, you know how it is, Mrs. Smith, oh my God, she's on the schedule again today. What are we gonna do? You know those. They're not getting better. This is the device. I'll have, you know, I've done this a couple hundred times, so I'll tell you, most people are like, whoa, how is this compared to an ultrasound? Well, ultrasound is like 1968 technology, okay? And you've got a lot of them. And I'm not busting chops, but I mean, I have 2 of them as well in our clinic. What is it compared to a cold laser? Best way I can explain it, you take a cold laser, you put it on steroids, and you multiply it times 100, okay? And cold lasers are $50,000 to $60,000. So I know I just made some big claims, but I would love to be able to demonstrate this. And we have a saying, you have to feel it to heal it. And if you're running this over normal tissue, no pain. The Chicago Cubs and Cleveland Indians are using this as true preventative health care. They have one in the training room for acute injuries, but they have another one in a different part of the facility where players come in once a month. They're scanned both shoulders, both elbows, both wrists, both knees, right? Because it's true preventative medicine. If they can detect little problems before they become big ones, think about how much they can have the players on the field and not be on downtime. I don't know if you guys heard, but you know, in April, LeBron James had his 26th high ankle sprain. Maybe it was his 27th. But he was out for 5 weeks. He was using this weekly, if not daily. I have seen nothing that works better for chondromalacia patella. You know what that is? Grinding of the patella, right? It's not trapped right. Michael Jordan made those little neoprene sleeves famous because he would wear them for tracking of his patella. This helps reduce inflammation, helps improve lubrication, and it's really cool. So plantar fasciitis, carpal tunnel, shoulder issues, golfer elbow, tennis elbow. I mean, those other ones work wonderful, but this, you'll notice that people will get better quicker, faster, less visits. And I have a saying in our clinic, our patient's time is just as important as our time. And a recent study that was done a few years ago with laser therapy, actually done out here in Hofstra. So it looked at cold laser compared to our technology, extracorporeal shockwave therapy. They had patients, same diagnosis. They had cervical, trapezius, myofascial pain. And in the group that went in for a cold laser, they were treated once a week, five times per week for 3 weeks, 15 sessions. The other group came in once a week for 3 weeks with our device. So they had 3 visits to 15 in the same time period. The patients in our group had better outcomes, their VAS scores were lower, and obviously they needed less visits. So in today's world, that's what it's about. So who's first? Jump on. Who would like to be our first?